What if one key to preventing a stroke was in your kitchen cabinet? Every year, hundreds of thousands of people in the United States have a stroke, but research indicates you may be able to lower your risk with a few potent spices. In this video, we will explore 5 spices, supported by scientific research, that help address the inflammation associated with stroke risk. You will learn not just what they are, but how you can use them to support your brain health. First, it is important to understand the focus on inflammation. Acute inflammation is the body's natural protective response to injury. However, when inflammation becomes chronic and long-term, it can be harmful to the body's blood vessels, including those in the brain. This chronic inflammation can contribute to atherosclerosis, or the hardening of the arteries, which is a primary risk factor for ischemic stroke, the most common type. Scientific studies show a direct correlation between chronic systemic inflammation and an increased risk of stroke. Elevated inflammatory markers in the blood are associated with a greater likelihood of having a stroke. This creates an environment in the brain that is more susceptible to damage. Fortunately, diet is a powerful tool for combating this threat. The 2024 guidelines from the American Heart Association and American Stroke Association continue to emphasize that a healthy lifestyle, including diet, is the foundation for stroke prevention. Within that diet, certain spices are notable for their anti-inflammatory and neuroprotective properties. These are not merely flavor enhancers. They are botanicals that have been used for centuries and are now being validated by modern science. Let's explore the 5 spices you should consider adding to your meals to protect your brain. First on our list is the golden spice, turmeric. For thousands of years, it has been a cornerstone of Ayurvedic and traditional medicine. Today, science is confirming its value, especially regarding brain health and stroke prevention. The benefit of turmeric is attributed to its main active compound, curcumin. Curcumin is one of the most studied natural anti-inflammatory and antioxidant agents. Its primary mechanism involves blocking NF-κB, a molecule that activates genes responsible for inflammation. By suppressing this molecule, curcumin helps reduce the inflammatory processes that can damage blood vessels. How does this specifically help in the context of stroke? Chronic inflammation is a direct contributor to plaque buildup in arteries. Research indicates that curcumin can help fight this process. Studies have shown that curcumin can lower cholesterol and improve the health of the endothelium, the thin membrane lining the heart and blood vessels. A healthy endothelium is vital for regulating blood pressure and preventing blood clots, 2 major factors in stroke risk. Furthermore, studies on animal models of stroke have demonstrated that curcumin can reduce the size of a brain infarct, which is the area of tissue damage resulting from a lack of blood flow. The neuroprotective effects of curcumin are significant. It has been shown to protect against stroke-induced brain damage and improve neurological function in multiple studies. Some researchers suggest curcumin may be a promising therapeutic strategy for stroke, not just for prevention but also for aiding recovery. Adding turmeric to your diet is simple. You can sprinkle it into soups, stews, and curries, or blend it into smoothies. A popular method of consumption is golden milk, a warm drink made with milk, turmeric, and a pinch of black pepper. Here is a crucial tip. Curcumin on its own is not well absorbed by the body. However, pairing it with black pepper, which contains piperine, can increase curcumin's bioavailability substantially. A 2024 study on post-stroke patients found that supplementation with curcumin and piperine significantly reduced inflammatory markers, cholesterol, and blood pressure. Whenever you use turmeric, remember to add a little black pepper. Next is a spice that is both a culinary staple and a traditional remedy, ginger. Used for centuries for various ailments, its benefits extend to neuroprotection and stroke risk reduction. The medicinal properties of ginger derive from its active compounds, primarily gingerols and shogaols. These compounds are known for their potent anti-inflammatory and antioxidant effects. Similar to curcumin, ginger works by inhibiting the production of pro-inflammatory chemicals in the body, targeting enzymes and pathways that can lead to vascular damage. Regarding stroke prevention, ginger's effects are twofold. First, its anti-inflammatory action helps protect the integrity of your blood vessels. Second, some research suggests ginger may have mild blood-thinning properties, which could help prevent the excessive platelet aggregation that leads to dangerous clots. However, the evidence in humans is mixed and not as robust as in animal studies. Therefore, ginger should never be considered a substitute for prescribed anticoagulant medications. Individuals taking blood thinners should consult their physician before regularly consuming ginger. Scientific studies have begun to illuminate these effects. Research in animal models has demonstrated that ginger can be beneficial in protecting against the type of brain damage caused by a stroke. In these studies, ginger extract was shown to improve cognitive function and reduce the volume of brain damage. Incorporating ginger into your diet is both easy and delicious. You can brew fresh ginger tea or add freshly grated ginger to stir-fries, marinades, and salad dressings. A teaspoon of ground ginger can also be added to oatmeal or smoothies. Our third spice is one of the world's most popular aromatic spices, cinnamon. Often associated with baked goods, cinnamon possesses remarkable health properties that make it a valuable ally in supporting brain and vascular health. Cinnamon's power lies in its active compounds, particularly cinnamaldehyde and various polyphenols. These compounds are potent anti-inflammatory and antioxidant agents. Research has shown that cinnamon can help reduce inflammation, which is crucial for protecting arteries. Cinnamon's benefits for stroke prevention are linked to several mechanisms. One of its most documented effects is its ability to improve blood sugar control. High blood sugar is a significant risk factor for stroke because it can damage blood vessels and promote inflammation. Cinnamon has been shown to help slow stomach emptying after meals, which prevents sharp spikes in blood sugar, and it can improve insulin sensitivity. By helping to maintain stable blood sugar levels, cinnamon indirectly protects the vascular system. Furthermore, preliminary studies are exploring cinnamon's direct neuroprotective effects. Some animal research suggests that cinnamon extract may help protect the brain during events like a stroke, but this requires more investigation. Two main types of cinnamon are available, cassia and Ceylon. Cassia is more common, while Ceylon is often called true cinnamon. Cassia contains higher levels of coumarin, a compound that can be harmful to the liver in large doses. For regular use, Ceylon cinnamon is often recommended as the safer choice. Adding cinnamon to your daily routine is simple. Sprinkle it on your morning coffee, tea, or oatmeal. A half to 1 teaspoon per day is a commonly recommended dose. Our fourth spice is an aromatic herb common in Mediterranean cooking, rosemary. It is packed with compounds that offer significant anti-inflammatory and neuroprotective effects. Rosemary's primary active compounds are rosmarinic acid and carnosic acid, which are known for their antioxidant and anti-inflammatory properties. They work by neutralizing harmful free radicals that cause oxidative stress, thereby helping to maintain the health of the vascular system. The connection between rosemary and stroke prevention is an emerging area of research. Animal studies have indicated that rosemary extract may have a protective effect against brain damage from ischemic stroke. In one such study, pre-treatment with rosemary extract significantly reduced brain infarct size and swelling. While promising, it is important to note that direct evidence for stroke prevention in humans is still limited. Rosemary has also been traditionally associated with supporting cognitive function. Modern studies suggest it may help improve concentration and memory, partly by supporting blood flow to the brain. Rosemary can be used fresh or dried in a variety of dishes. Add it to marinades, toss it with roasted vegetables, or bake it into breads. You can also make a simple rosemary tea by steeping a sprig of fresh rosemary in hot water. By using this fragrant herb, you are consuming compounds that fight inflammation and support the long-term health of your brain. Our fifth and final spice is another aromatic herb with a long history of medicinal use, sage. The name sage derives from the Latin word salvere, meaning to be in good health. Sage contains potent anti-inflammatory and neuroprotective properties relevant to stroke risk. Sage is rich in beneficial compounds, including flavonoids and rosmarinic acid. These compounds are responsible for its antioxidant and anti-inflammatory actions. Studies have shown that sage can inhibit key inflammatory markers in the body that are often elevated in conditions that increase stroke risk. The neuroprotective qualities of sage are particularly compelling, though much of the research is still in early stages. Research suggests that sage may help protect brain cells from various forms of stress and toxicity. By shielding brain cells from damage, sage helps maintain a healthier, more resilient brain. Furthermore, sage has been studied for its effects on cognitive function. Multiple studies have demonstrated that sage can enhance memory and attention. One proposed mechanism is its ability to support healthy cerebral circulation, ensuring the brain receives a steady supply of oxygen-rich blood, which is fundamental for both optimal cognitive function and reducing stroke risk. Sage's strong, peppery flavor pairs well with poultry and savory dishes. You can add it to sauces, soups, and stews. Like our other spices, sage can also be brewed into a tea. If you are finding this information valuable, please take a moment to like this video, subscribe to the channel, and turn on the notification bell so you never miss our expert-backed health content. And we'd love to hear from you in the comments. Which of these spices are you already using? Sharing your experiences can help our community learn new and delicious ways to stay healthy. So there you have it. 5 spices that may play a role in reducing the risk of stroke by helping to combat chronic inflammation. We started with turmeric, whose active compound, curcumin, is a potent anti-inflammatory. We then moved to ginger, which also fights inflammation and may support healthy circulation. Our third spice was cinnamon, which helps protect our vascular system by contributing to stable blood sugar levels. Fourth, we explored rosemary, an herb that shows promise in protecting the brain from ischemic damage in preclinical studies. And finally, we discussed sage, another herb that may enhance cognitive function and fight inflammatory processes. What's truly empowering is that these are accessible spices. Incorporating them into your daily meals is a simple and proactive strategy to support your health. Of course, it is essential to remember that these spices are most effective as part of an overall healthy lifestyle. The 2024 guidelines for stroke prevention continue to emphasize the importance of a balanced diet, like the Mediterranean diet, regular physical activity, managing blood pressure, and not smoking. These spices are not a cure-all, but rather supporters of a healthy lifestyle. Before making significant dietary changes or using spices for therapeutic purposes, it is important to consult with a healthcare provider, especially if you have existing health conditions or are taking medications, as some spices can have interactions. The journey to good health is built on small, consistent choices. By reaching into your spice cabinet, you can take a meaningful step toward protecting your brain and investing in your long-term vitality. Thank you for watching.